Hey, it's Kevin Henry, the Director of Marketing for Fortune Management. And when I think marketing, I think our friend Fred Joyal. Fred, thanks for joining us today, man. I appreciate it.
Always happy to be here, Kevin. Always happy to talk about marketing.
Well, let's talk about the second half of the year in marketing. And I wanted to kind of get your 30,000 foot view on some of the things that you think are going to impact dentistry in the second half of 2021 and what our practices need to kind of be on the lookout for.
Well, there's some really big things that shifted people's perspective in 2020. And one of the big things that I noticed, and I think a lot of dentists noticed, because I see a lot of dentists who are having really big first and second quarters, particularly their second quarter. I've talked to dentists who had their April was the biggest month in their career. And I think what we're seeing, and this means it's a great opportunity, is that people are reprioritizing where they put their money. Like they had a year to go, all these things I thought were so important were not that important, but my health is really important. And there's this chance to really connect those dots between your overall health and your oral health. I think there was a lot more information about the immune system and everything like that. Extremely valuable to put it in your mindset and your team's mindset that people have become more aware of the connection. And they are more interested in taking care of their smile. One of the things that we've talked about a lot is the Zoom smile. I've never looked in the mirror so long every day in my life. I mean, sometimes I've looked at my face for 8 hours, right? Even I'm checking my veneers, like, do I need a little edging done on these things? So this is people are realizing they got a little bit of work to do on their smile, and they're thinking about their appearance in general. This is why dentists are busy. People have been putting stuff off, and they've shifted their spending. They're going, wow, maybe that Vegas vacation isn't the investment I want to make right now, or maybe I don't need a new car. I didn't drive last year and I was fine, right? Yeah. So I'm gonna be Ubering from now on, or I'm keeping this car forever. And suddenly that's freed up money for them. So that's a great opportunity. And then one of the other things that I've seen was from a technological standpoint, behavior has changed. And you know what I'm going to say, it's teledentistry. Sure. 2 years ago, if you ask me, I'd say dentists aren't ready for teledentistry. And you ask the dentist, they go, it can't work. I need to see the patient. Right. Well, everybody found out you don't need to see the patient, and not everybody, but 20-30% of practices started using teledentistry, and they found out has a huge advantage, and I've found some really interesting marketing advantages to it. But you can triage the patient, an emergency patient. Maybe they don't even need to come in. Maybe bringing them in would be pointless because you're just going to give them a prescription for antibiotics and then see them in 3 days. So now you're doing it all in 10 minutes from your phone, and like the rest of us with no pants on, right? So you get to do this with the patient, but there's all of these other things. It starts a relationship with the patient in this visual format. I think the other thing we learned is that these things are, as much as we're zoomed out, a lot of us, FaceTime and Zoom is way better than a phone call. Yeah. Grandparents and stuff like that, who were totally shut-ins, felt connected to their families. So yeah, no, it's good stuff. You mentioned the Zoom boom, you mentioned the oral systemic link, and people more in tune with their health. Is this a time that dentists and team members really bone up on that whole case presentation side of things and those skills that are needed to really talk to people about that? Yeah, because there's like that when you've got somebody who's more interested in something. We only absorb information that we're interested in. It's why we didn't learn anything in high school, right? It's none of it mattered to us. American history, we didn't care. But so when they suddenly care about this stuff, you can say, look, your immune system's pretty important to you, isn't it? Oh, heck yeah, right? I'm one of the people who's not going to get vaccinated. I need a strong immune system because it's going to be 20% of the people aren't going to get vaccinated in this country. So maybe that's they want to have a strong immune system. Say, you got to have healthy gums. You got to, and yours aren't, I can tell from here. You don't want to say that, but you can tell from there, even through their mask, through your mask, you can tell. And so this is a great time because education alone doesn't work. Education, when there's a perceived need and a desire, then it's suddenly effective because now they make the connection. So it's a great time for that to, in your morning huddle, say, remind these people that we are the immune system masters in our place.
So you mentioned the second quarter of the year being so strong for so many practices. How do practices keep that going in the second half of the year? Is it just the reminders about oral health and the importance, or is it just that people you think will keep thinking, this is more important than that trip or that car, or whatever it might be?
I think it's also that there is an opportunity. There's a lot of stuff. This is a lot of what Fortune gets involved in is mergers and acquisitions. There's people migrating from practices, one that they didn't feel safe in because the practice didn't institute any safety measures, or that the dentist just said, I can't live in an N95. I'm hanging it up. I'm 65 years old. I was going to work till 70. I'm giving it up. And they have essentially released their patients into the wild. They don't have an associate in place. I talked to one dentist. She said, as she was coming out, this was January, February. She said, and even before that, even October, November of last year, because she was open, she said, I'm without advertising right now, I'm getting more patients, new patients than I ever had before. She said 50% of them were file transfers. Okay, all of that, they were coming from somebody else that they didn't want to go see anymore. This was a great migration in my mind of people moving to practices with better safety measures, better technology, because of course, what do you want now? When you're going to the dentist, I really want to be in and out of there as fast as possible. So sure. Now you're using CAD CAM technology, you're using lasers, you've got all of the paperwork's done digitally. Everybody should be doing their forms online, right? That should all be done. So the person walks in, is in there, gets treated once, gets the crown done in one visit and goes, or gets prepped with a laser and treated and they never get anesthesia. That's huge for a patient. You shrink that time. And of course, all of this creates the remarkable patient experience, which so we're snowballing on, they care more about their immune system and we're treating them faster and we're probably the safest place they're going to go. That's what people figured out as they walked into a dental practice in October and they went, this is way safer than my house and my grocery store and my doctor's office or the ER. And so they caught on that, like the dentists were saying, we care about you. Every dentist website had like their whole COVID procedure up there. It's a big deal.
And I love the practices that marketed, we were taking care of you before COVID was a part of things. We've been doing infection control and protocols for so long. And I think that really resonated with a lot of people as they started to come back into society.
Yeah. So the opportunity is there to take us to where people are going. Even just to me, now's the time to start to tell people you should be coming in 3 times a year. There's no reason not to tell them that. Anybody who's ever switched, including me, their prophies from every 6 months, which is technically every 8 months, right, to every 4 months, it goes way better. And of course, the long-term result is you're protecting your soft tissue. The gums are not slowly peeling back. And you say, look, every time I got to chisel all this plaque off, it means all this bacteria has been seeping its excrement between your tooth and your gum, and the gum is gradually separating and peeling back. It's really simple. I love when you break it down into non-clinical terms and you go like, this is exactly what's happening. It's really slow, but over years, this is you want to say, this is where the expression long the tooth comes from. It's a literal term about your teeth are longer looking because your gums are a couple of millimeters lower, and then eventually several. So just a great opportunity to just reverse that thinking, twice a year thinking. That's why Fortune's Plan for Health is automatically sets people up on 3 months, every 3 times a year instead of 2.
Love that. Absolutely. And Fred, so many great ideas, so many great thoughts. And I know that you've got a lot of these and that you're keeping up with marketing trends, what people should be doing. How do they find you? How do they get a hold of you? What's the next step to reach you?
Easiest way is to go to fredjoyal.com. You can buy my books there. You can actually sign up for a video course there if you want. And all of that information about me, and you can just write to me. You can contact me, Fred at fredjoyal.com, and I'm happy to help. And and I work primarily with Fortune Management because they're all over the country, and they have great consultants, and a lot of times I'm doing marketing consultations with those consultants in their clients just to dial in, because everybody's practice and everybody's neighborhood is a little different. But there's a whole bunch of things that I can take any website and look at it and go, tell them the 5 things they're doing wrong, which is hard to look at, like, it's like, where's your name, or something, where's your phone number? It's like, but don't you love the video? Yeah, but it makes it load in 10 seconds, right? It's not a good idea. So.
Fred, I know Fortune loves having you as a part of things and loves working with you. And hey, I love picking your brain. So I really appreciate the time today, my friend. Thanks so much.
All right. It's always a pleasure, Kevin. Thank you.